case you need to review items discussed or you needed to jump off and missed a section. Some of our partners aren't able to make it at this time and enjoy having the option of being able to catch up from the call off of the recorded YouTube. So we appreciate everybody being here this morning. It's November 20th. This is the NEMSIS v3 implementation call. Just as a reminder, and for those people who are new, this is a participatory call. So please feel free to ask questions either by unmuting your microphone or using the chat feature. After each section, we usually leave a little bit of open time and know that sometimes it takes you a minute to get to that unmute on your microphone. So if you have questions during the conversation, please bring those up. Also, there's an opportunity at the end of this call for open forum. If there are questions, issues, concerns, that is certainly a great opportunity for you to bring those up and to be able to discuss them. We're going to go ahead and get started with the first item on our agenda, and that's the review of the CMS 2020 update. Ryan brought that to our attention on the last call, and then we had some other vendors also contact us about the physician certification statement that's being changed for CMS in 2020. I'm going to go ahead and pull up. It is in the Federal Register. So this is just the Medicare program 2020 update for the Federal Register, and it lists 3 additional people who can be who can sign a non-physician certification summary, and that's the caseworker, a social worker, and a licensed practical nurse. So one of the questions with that was in e-payment 05, on the NEMSIS standard, it doesn't offer those 3 options, and we are going to add those 3 additional options to e-payment 05. So let's go ahead and pull that up so I can show you right where that is. So in e-payment 05, healthcare provider type signing the PCS, we'll add those 3 values, caseworker, social worker, and licensed practical nurse, so that you're able to better reflect the CMS requirements. And now that CMS 2020 update is slated for implementation January 1. Are there any questions or concerns on that CMS 2020 update? Okay. Oh, how about for 3.4? So we are updating it for 3.5. For 3.4, I don't know, Clay, what do you think about that?
Yeah, I think for 3.4, what we could do is define a custom element of 3 new values that we could provide in the form of custom values associated with e-payment 05 and post that in the custom element library so everybody implements it with exactly the same structure and content. We'd be happy to do that if folks think that's a good idea, and it certainly does for 3.4. Does that make folks, or make sense to the vendors on the call for us to just build a custom edition, and then we'll define the roll-up and other kind of attributes that are associated with that, and we can kind of ensure that it's standardized across the standard. Does that make some sense?
It's probably fine for us. You know, a lot of billing companies that receive NEMSIS data, a little unsure about how good the uptake will be there.
Yeah, so describe that a little bit more, would you please?
Say it again.
Can you describe the concern with uptake a little bit?
Right.
Further?
So I'm unsure about most of the billing companies we work with. They tend to just take straight NEMSIS v3, 3.4, 3.3.4. and whether they would have the mechanisms to deal with custom elements. A little unsure about that, and if the data has to pass through a state first before it goes to the billing companies. I'm not sure how well the uptake will be there either. I think it's less on the PCR vendor side and more on those other links in the chain. If that makes sense.
That does. Yep, I understand what you're saying. And I think if this does become an issue, so we can attempt this approach. But if folks feel like something like this is worth a critical patch, I mean, if it really comes to that, we can certainly do that. But I think this might best curb the issues. We can certainly track this along and see if there's if the uptake of a custom values added to ePayment 05 is not going to work very well, then we could certainly discuss with the Office of EMS at NHTSA the opportunity to do a critical patch for 3.4, I guess.
Hey, Clay. I kind of feel the same way as David does when we're talking about sort of those receiving systems at the billing company sides, processing V3, especially 3.4 files. I think the way that the majority of it has been designed just to take a very plain 3.4 file and don't account for any custom elements. The way that custom elements in there would sort of leave them sort of in distress. Also, just not knowing when there's a good clean roll up, or there's not a clean sort of other or any other selection on that list. It's kind of worrisome that they'll end up with just the wrong data in some instances.
Yeah.
And I have a question about if the physician's signature isn't able to be caught on electronically, let's say it's fax attached because the signature tab goes out. If you set it up as a custom element, are there going to be pertinent negatives? Are you going to be able to indicate that it's there but maybe not screen captured? You know, like those kinds of items. So that it doesn't look like it's missing when it's not?
Yeah, this is Clay. I'm not tracking real carefully with what you said. Can you describe that one more time? I'm not really tracking with what the issue would be.
So if the physician's signature is not captured electronically, so that it's a screen capture in the custom or a GIF file or however it's being sent, are there going to be, if it's set up as a custom element in 3.4, are there going to be pertinent negatives that the custom element would accept that would indicate whether it was attached hard copy, right? So there's a picture of it, it's just not in that element, it's attached as a hard copy, or is there a pertinent negative that says unable to capture, or is it going to be set up? I just want to make sure that all of that, if it's set up as a custom element, is there in the custom element.
Got it. Julianne, can you bring back up ePayment 05? So no, the way it's written now, we don't have that ability to do it. So that would be a modification to the current element, right? I can see.
Well,
go ahead. Sorry, was that Keenan? Sorry.
it was Ryan.
Ryan.
Before we go too far down the modification path, physician certification statements typically exist on a paper form. Signatures for them are not captured in ePCRs, usually to prevent even the hint that someone other than the signer has been completing this attestation that a service is necessary under CMS standards. So you want to have a form that's written in the same handwriting as the physician who's signing the form, or someone other than the medic. So even in other 13 signature reason, we can identify that it's a physician that signed it, but there is no reason for a signature that's related to the physician certification statement. So even in a custom element, I wouldn't anticipate that you would have PCS signature appearing electronically on the record along with e-payment 05, the identity of the person who's signing it.
So we're only talking about the e-payment 05 type. We're not talking about the actual signature then.
Right.
That's correct.
And it's going to be a required field?
No, that field will remain as it's currently structured.
Okay.
I do want to chime in that I don't think all vendors have the same position as Ryan stressed or stated. There are vendors that will take a contemporaneous signature from a physician inside the software itself.
Yeah, makes sense. So I think again, all we're really talking about here is adding 3 values through the custom process. The e-payment 05, no change to the structure of the element.
Are there any other questions for this this change? Okay.
I mean, what are the steps forward, right? We've basically placed like our development on these new elements on hold, or the new values on hold, because we don't know how to output them in a 3.4 file. So what's our next step here?
Yeah, this is Clay from the NEMSIS TAC. I think our next step is to develop that that custom word for e-payment 05. We can try to have that up by next week and just have that in the library and available. Would that address your concern and the reason why you're waiting, Keenan?
It would for me, but then sort of my counterpart in our billing departments for our couple of billing softwares, I think it needs to be sort of conveyed to them, and they should probably have some input on how best to process that data. Or actually, I don't know. I don't know who should represent that side of things, but it's concerning that we might be able to put out a 3.4 file January 2nd and nobody actually be able to process it.
Yeah, I hear that. I hear that concern. I guess, does anyone really wait and not bill until the data element has been sent to the state? Is that true?
What the?
I don't think I understand that question.
Clay, could you repeat your question?
Yeah, sorry about that. I'm trying to understand the concern from the billing side, right? So this entire e-payment section just has values that we've tried to attune to current billing standards. I imagine billers are dealing with the same issue. By just adding these values onto e-payment 05, the billing section and however it's used will continue to be the same. So I'm not sure what an addition we would gain. I think Jennifer talked about this idea that some places they may not have billers look at the data until it's been sent to the state, and so their concern would be that maybe the custom element part of V5 or V-payment 05 may not travel up to the state. But does that happen? I'm not seeing whether they're what the what the additional complications would be by just adding a standardized custom 3 values to be payment of 5. I guess I'm still struggling with understanding. The billers want the values. We add the values. What in addition do we need to worry about?
I think our questions are, will the billing softwares be able to take and process the custom element itself, right? I don't know if we've sort of entered this territory with billing software as much as we have just with state submission software and stuff like that. So what we're saying is we're going to refactor this element to send in a V3 file. Are the billing companies going to be able to process the 3.4 file that we send them with whatever changes? We don't know if adding a custom element is something that they would easily be able to do, because I don't think most of them have done it before.
Okay, I understand. Yeah, thank you for that clarification, King. Who would folks do? Is there a core set of billing folks that we should be contacting? People could certainly connect us with some folks. Is this enough of a concern for us to just? Yeah, no, I can't imagine doing a critical patch on 3.4 for this. I guess we certainly could, but.
Well, if there's any reason to do a critical patch, money is one of them.
Yeah, that's true. Could folks email me with some contacts for billers that they think might be able to address this question about their ability to uptake custom values associated with an element? If you email those or put those in the chat, we'll call them and try to determine if there's going to be an issue with that. And if there really is, then we may need to do a critical patch, I guess, to address it. You can hear a small child in the background. Is there someone that needs to mute their phone? All right, great. So we'll do some additional investigation to see if this would be an issue. Please pass along some contacts, particularly if you know some folks that could really give us some good insight here. It's going to be hard for us to capture the entire industry, but it would be helpful if we could make some calls.
All right, sounds like we've got some next steps on both sides for that issue. Anything else to add? Okay. Laurel, are you ready to talk for just a second about the December public training?
Sure. I don't know if you want to pull up that. Oh, there you go. So our last training for this quarter is coming right up on December 3rd. I believe that's Tuesday at 10 a.m. Mountain Time. We're going to be looking at our flu surveillance dashboard that we have, and I will be doing the training. I'm happy to answer any questions about that if anyone has them. Otherwise, I look forward to talking to you on the 3rd.
Hey, Julianne, will you be sending out another reminder we can forward to our folks with the, oh no, this is available, right, where we could grab that and get it out to our folks and remind them?
Yep.
I try to forward it to all of our people to get as many folks on there, but well, sometimes nudging is always good.
Yes, it is. And you can pull that right off of our website. So the main NEMSIS website, calls and trainings, public sessions, and then the training calendar will be right here. So I can forward it to you if you want. You're welcome to just pull it off.
No, I could go
Okay.
I can go get it. I always forget. Thank you.
Okay. And then they can do the QR code and add it to their calendar. It does add all 4 at once. We didn't do individual ones for each session, but they don't have to sign up, so they can just join. And these sessions have actually been really valuable, a lot of back and forth. So it's a great opportunity to ask questions and to get into some detail on those issues. All right, Laurel, I think you've got the next item as well.
Yeah, so I'm going to talk a little bit about the current 350 bugs and changes and our timeline for that. Julianne, if I could have you go to the NEMSIS website.
Sure.
But, I mean, you were already sharing. I just figured it was faster.
Yeah.
So I'm just going to walk you all through where to find that list, and I'm not going to read through all of them because we've been reading through all of them, and I think that it would be just very repetitive for people. You're not sharing anything.
Oh, is it not showing?
It's not.
All right, let's give you a screen to look at then. How about that?
There we go. So from the home page, if you just click on that 350 release timeline, it'll take you to the timeline, which is where you can kind of see where things are. So in this first image, I'm going to do the timeline first today. In this first image, it just shows where things are. So right now, we are in November 2019, and we're getting ready to release compliance. So our schedule got bumped a little bit by the critical patch that we're working on for 3.5 right now. So you should see that critical patch in the next 10 days by the end of the month, and then shortly thereafter, you will see all the compliance testing materials. We just want to be absolutely sure that the test cases are valid under the critical patch, as we had initially built them under the existing version of 3.5 before we had some changes. So then compliance testing materials will be available, and you'll be able to begin preparing for that testing. We will have some of our usual compliance testing web services available right off the bat in the beginning of December, and probably all of that system will be entirely stood up sometime in January. We're taking a little bit more time for development rather than updating our some of our compliance testing web services that have been around for many, many years. We've chosen to rebuild them to make sure that they're as secure and up-to-date as possible. So we're going to take a little bit of extra time on that, but that doesn't mean that you can't get started entering the test cases or moving through the other parts of compliance testing that you're probably all too familiar with. So that's where we're at with compliance testing. Data acceptance at the TAC is still slated to open by the end of February. We don't, at this time, we don't see that deadline changing, that time changing. We still plan to have that ready by February. So if you guys are ready to submit, we will be ready to receive your data at that time. So if you want to scroll down to the next image, Julianne, I recently had someone ask me, when does compliance testing close for NEMSIS 3.4? And the answer is, I thought it was on this one. It's in 2021, I believe, March of 2021. So if for some reason you are not compliant on 3.4, you still have plenty of time to do so. If that was a burning question in anyone else's mind. Okay, so back at the top of this page, if you wanted to get to the list of bugs, you can just go in the breadcrumbs to 3.5 revision, and then scroll down to how can I follow along, and then click on that NEMSIS Public JIRA project. So this is our list of everything that we're planning to do. The list on the far left, selected for development, are the items that are going to be contained in the critical patch that we are going to be doing by the end of this month. If you click on any of those items, you can be taken to a screen where you can see all the details, a full description of what the change will be, any comments that we've made internally as we've worked through the change, and you can sort of get a big picture. And as always, if you have any commentary, feel free to email us or give us a call. or let us know. And if you have any changes or that you want to see for 3.5 or any bugs or issues that you've noticed, please let us know as soon as possible so that we can make sure they are included in that critical patch and we never have to version NEMSIS again. Does anyone have any questions about the bugs or the timeline or compliance testing, or I'll entertain questions about recertification as well? Okay, sounds like there are no questions. If you think of one later, feel free to send me an email or reach out to me in some other format. I'm happy to help you in any way I can.
Thank you, Laurel. Let's go ahead and move to item number 5. That's an addition to the agenda that was sent out earlier. Clay's going to spend a few minutes talking about the implementation of an exchange guide from ambulance to emergency departments. Clay?
Yeah, thanks, Julianne. So with the release of version 3.5.0 and now the critical patch that's coming out, we're deep in the process of determining how best to develop an exchange implementation guide to move a standard, generally structured electronic patient care report from the back of an ambulance to an emergency department. So in the past, with version 3.4, we went through HL7, developed an HL7 version 3 implementation guide for moving that PCR in 2 forms. One was a kind of a level 1 CDA structure that just provided a wrapper around a PDF that could be exported to the emergency department and opened up as a PDF. We also developed a level 3 type of CDA that allowed all the data that was being transferred from that patient care report to be machine readable into a hospital patient record, right? So, and I think that was fairly well utilized. What we're now struggling with is trying to determine whether we should develop the 3.5 guide using NEMSIS version 3, or whether we should consider using FHIR. We've also received a number of complaints where systems, hospital systems particularly, are still using HL7 version 2, and so kind of the document structure of building it in version 3 was problematic. I just wanted to ask the vendors as we move forward and try to develop the consulting team that will do this work, does anyone have a preference, or could you speak to a preference as to whether or not we should go through HL7 again? And if so, should it be built using FHIR, or should it be HL7 version 3, for example? We just love to hear from vendors as to how best we can build an implementation guide that would be most helpful.
Might be more a question for who's the people who are actually going to consume it, because we're familiar with the data on our side and we can implement probably any of those ones, but if they're not going to get taken on the ED side, then it's not going to work. And I think they're more picky audience for that. They might be the choke point of what gets adopted and what doesn't.
Yeah, this is Clay again. That's a great point, and we're planning to do that. So that's really a great point. Have others, when you've gone to implement that process, have folks received feedback from the hospitals regarding the format they'd like to see? So I know there's software products on the phone who have connections into emergency departments moving that patient care report. Are you guys struggling Did you struggle with implementations in 3.4 based on something that we did here at the TAC? Could there have been a different approach we could have taken that would have been helpful for your side of the handshake? Well, I'm just not hearing any comments. I mean, Keenan, do you have any comments, or Ryan? Have you guys faced any problems with this?
Not particularly. 3.4 is just kind of working. We have bigger fish to fry right now, to be honest.
It seems like most of the EHRs and the hospital records are pretty bought into the HL7 standard. Our integration allows for element data mapping over to EHRs, but the comment earlier that the hospital consumer really is the driving force behind how the data is going to be consumed is accurate. I don't think HL7 is going anywhere. And like was said, it seems like 3.4 is working well.
I don't know if it's worth us trying to move the goalpost ourselves as much as allowing the consumer to be the driver there.
All right, we can certainly take that tack. We struggle a little bit. There's, as folks know, there's even less conformity on the other side of this handshake than there is on our side, right? So if we speak to Epic, it can be somewhat different than what Cerner says, and we get lots of feedback that that there's special builds often. So we're just trying to see if we can reduce the burden associated with allowing electronic patient care report to be available in emergency departments and then into medical records. How about Elizabeth or Jennifer from AMR? Are you folks doing any integrations into emergency medical record systems in hospitals?
We have a few that we send directly to, but most of them will go through their state system if they get the electronic information.
Oh, so into an HIE or something and then out to the hospital? Is that what you're saying?
Right. So we, like, for example, most states that have one of the vendors, we send it to the state, and that vendor sends it to a hospital hub where the hospitals can access their information.
Okay, that makes sense. All right, any other comments that folks have that may help us kind of prescribe the questions we ask among the consumers of the PCR?
If you can get some of anybody on the EHR side to really buy into having an emergency related data set, HL7 based or otherwise fire based or whatever, that'll drive you through to the other vendors as well, because they'll want to compete with that. So we're definitely the wrong audience, but if you can find someone there who says, yes, we want to do this as a project, then you can get a lot more adoption.
Yeah, that's a great point. Thank you. All right, Julianne, I'll turn it back over to you.
All right. The next item on our agenda is anything from the Office of EMS, NHTSA. We've got Eric on the line with us this morning. Eric, do you want to take a minute?
Can you hear me, Julianne?
I sure can.
So two things. One, January 29th, 2020, we will be sponsoring NHTSA Office of EMS and the Office of the National Coordinator are hosting a pre-hospital to hospital data summit for the National Security Council, who has taken this on as a project this year. The meeting will be in Washington, D.C. at the JW Marriott. We have sent invitations out, so I know that all the EPCR vendors were sent invitations to the meeting. It's an all-day meeting, and the goal and purpose is to discuss how to best integrate the pre-hospital data set into the hospital data set. We have representatives from the health information exchanges, from hospital vendors, Epic, Cerners, and so on, the EPCR vendors from our industry. The Office of the National Coordinator has hooked us up with the data and informatics national organizations. And as far as I know, this will be the first time we have ever put this group of people in a room to have this discussion. Currently, we've invited about 85 different organizations. So it will be very interesting to see how this day goes. We're pretty excited about it. The National Security Council's interest stems from a meeting at the Department of Homeland Security about 2 years ago now, where ACEP, the American College of Emergency Physicians, and the American College of Surgeons wanted to go back after active shooter events and do sort of a forensics data analysis and look at patient care from the field all the way through the final disposition of the patient. And they found out that they really weren't able to do that, and they had a number of different problems and issues in being able to track a patient through the system, and hence the National Security Council's interest. So invitations have gone out. If you haven't received one and you're interested, please, by all means, send me an email. We'll be happy to see that, that you get an invitation. There is not funding for bringing people in, so the travel is on your own. There is no charge for the meeting. And if you have questions, please let me know. The other topic that I wanted to mention is the RFI for NEMSIS, the request for information on NEMSIS, will be posted in the Federal Register. My understanding it was going to be posted Wednesday. It's not. There are some copies that went out. The due date for that is January the 3rd, I believe. Basically, it's just looking at simply, is there a better way to do NEMSIS? That's the direction from our Chief Information Officer. And you will be able to respond to that. The information there is included in the RFI. And if you have questions, again, just please reach out to me. I'll entertain any questions or any other concerns people have for NHTSA's Office of EMS. Thanks, Julianne.
Thank you, Eric. Let's go ahead and open this to open forum. So this is your opportunity to bring questions, concerns, comments that you would like discussed on this call. Is there anything anybody wants to bring into open forum?
Hey, Julianne. So we started undergoing the 3-4 certification, and we did send an email about it. I just wanted to bring it up to the group here. We started recertification on 3-5 or 3-4 rather, and noticed that some of the test cases want or require custom state elements that don't actually exist. And so that sort of puts us in a position where we have to specifically program custom state work that is attributed to a state that doesn't actually need it. And I just wanted to sort of get the temperature of the room on, you know, if that's something that we can talk about and discuss as maybe changing that practice, maybe to have custom elements that somebody does actually take or something like that.
Great question, Keenan. I'm going to go ahead and turn that over to Laurel. Laurel?
So I
There
didn't
you
read the test cases, and I don't really know how to answer that. Josh looks like he's on the line. He might be better to answer whether that would be reasonable. The problem that I see potentially is that the only way to test if you can create a custom element is to ask you to create a completely new custom element for us, kind of like with schematron rules. We don't test you on are the national rules implemented. We test you on whether the test schematron rules in this special schematron file we send you are functional. But Josh might have a better answer.
No, I would say about the same thing. That is exactly the purpose of the custom elements in the test cases, is to test that you have a software product that can, with reasonable amount of effort, implement custom elements. And so if that is an extraordinary amount of effort that's required to implement a custom element, then you may want to consider changes in the design of the software to support a more reasonable process. We know that custom elements will never be kind of drag and drop, you just throw it in and you got it. But that is an important requirement that software be able to implement custom elements with a reasonable amount of effort. It's not really going to represent a lot of additional cost to customers. So that's why we create custom elements in a hypothetical state, in a hypothetical agency for testing.
So this is Renee, but I'm trying to think back in the past of any time we've had to do work for compliance testing, and anytime we've had to do work, it's usually been work that wasn't throwaway work. So this feels like you're asking us to do something and throw it away. If we're going to spend development time on something and interrupt our schedules to bring something in that we're just going to throw away, that's kind of hard to swallow and a waste of our resources, any other vendors' resources that's going through this process. SaaS applications, they may have an easier way to do this. It's just interruptive. And so there's got to be a way for us to implement something that will be used. And I think, can we look for a possibility there?
And actually, I have a question for sort of the SaaS vendors. So if you build this specifically for Alabama, does that mean it creeps into your Alabama code? Do customers have to now endure it, or is it just hidden, or how does that even work?
I can't speak for everyone, but the way that we implemented custom fields is how it was described earlier, is that it's something that's configurable through, they're able to be created, activated, deactivated, and deleted through a UI without development resources, so that a state data manager could create a custom element if they needed to. A local department manager could create a custom element that's unique to their department if they needed to. So they can be created at a state or local level and activated or deactivated all without development resources. That's why, as was pointed out, that's why custom elements were included in the NEMSIS 3.4 standard the way they were, is so that we could meet the rapidly changing needs of EMS departments and states without having to disrupt our roadmap. So for us, wherever it's created, at whatever level it's created, it's available for as long as the customer desires, and then can be deactivated. So for testing, it's as simple as creating it, running the test, confirming it's sent, and then deactivating it so that it's never seen again.
So are you guys saying that there's a requirement that there is a user interface to add custom elements? Because we've never seen a requirement like that. We've always asked for states, as a vendor community, we've always asked for several months lead time from states to give us notice so that we could get the changes made, get the work into our development schedules, and get that out to our customers. So I've never seen anything that says you have to have a user interface to create those on the fly as part of any compliance testing or certification or anything like that.
And again, my apologies, I wasn't speaking for the requirements of NEMSIS. I was asked to describe how SaaS vendors solved the problem. I was describing how we solved the problem.
Okay, I thought you were saying that you did it according to the standard and that standard needed a UI. So I just want to clarify that. Thanks.
No problem.
So I can speak to what I ask about in testing. I do ask to see the interface where a custom element would be created. In the past, we have been, I guess, receptive to vendors who have said, that's done in the back end by us for customers. We don't have an interface that a customer uses. And the response has been, well, if you can create a custom element in a timely manner for them, and that's a service that you're choosing to provide to them in that manner, then that fulfills their requirements. So that's sort of what I've seen. I can speak in general terms about what I've seen with software. Many software programs do offer a user interface to add values to an element, if not add entirely new elements, but many softwares have stated that they handle that for their customers, usually with the reasoning to ensure that it is done correctly and the end user receives the desired result in their custom elements.
So you're saying that's ideal, that there would be a user interface, but it's not a requirement of compliance testing, correct?
At this time, I do not believe it is a requirement, but I am looking at the documentation to verify that. Okay. I have not treated it as a requirement.
If you are in 3.5 compliance testing, you need to explicitly state that. That's for any vendor that doesn't have a user interface for that, then that's extra 3.5 work. But it seems like for 3.4 recompliance testing, that seems like that it shouldn't be relevant at all. I think we need to demonstrate that we can supply custom information, and we're doing that in many, many states. We can prove that, we can show that, but kind of putting in information that will never be utilized, in coding for it, that seems unreasonable for compliance testing.
Yeah, this is Clay. Maybe I'll just comment quickly. So getting back to the core issue is the fact, I think what you're saying is you're being asked to implement a custom element that won't be used. There's not a straightforward answer for that, right? I mean, that's why they're custom elements. We would if we chose a custom element that's currently being utilized by some states, does that save Zoll time?
I didn't hear the last thing that you said, Clay. Was that a question? Yeah,
sorry. I apologize that I'm offside and I'm trying to speak from my computer and it's not working really well. But the core issue, I think, that you're mentioning is that there's extra work associated with developing a custom element that won't be used. If the cases that you're using for compliance testing included a custom element that's used by one or more states, is that somehow helpful?
Yeah, so that makes a lot of sense. I mean, compliance tests us on any custom field that's been implemented and is required in any state as mandatory. That seems totally reasonable, because there was never an expectation or that custom fields would be generated instantaneously. It was just that vendors could support them in their software, and we do. It's just for different vendors, they've chosen different paths. And it's not fair to retroactively make a requirement that something be instantaneous or have a UI. You know, if you want to do that going forward, that's one thing, but doing it retroactively is not fair. And
we're not saying that, Renee. I apologize. We've drifted a little bit off Keenan's initial question. I think his concern was you would have to develop a custom element that would have to be thrown away. Is that correct?
Correct. We don't want to do any coding that isn't going to be useful. We'd rather spend our time. If there's a state that's coming out with a new custom element and we're going to have to build it, let's build that one. Let's do that. Let's do real work and stuff that will really be used in our software rather than throwaway code.
From a compliance testing perspective, that presents a couple challenges. One is we have to find a variety of custom elements that test the various features we're trying to test, such as grouping, not values, pertinent negatives, one-to-manys, extending an existing element versus creating a new element. We have to test all of those different aspects of support for custom elements, so that can be a bit challenging. Probably there are elements out there that may hit on those, but it may be hard to come up with different elements, different existing state custom elements every year for new test cases. The second is that the state custom elements that are published, the code for those custom element configurations is published. In compliance testing, we test your ability to create a custom element without giving you the answer to the test. And so essentially, the existing custom elements published by states essentially give out the test answer, so to speak.
Yeah, that's right.
So, I mean, I think that these are wonderful things to think about for 3.5 compliance testing. And I think we should be careful about how hard you make it for vendors who've already certified and are demonstrating that they can do this, to make them put, when we were certifying for 3.4, we were still in development, and that's a really different thing than a software vendor that's been in the market with their product for a while. So unless there's problems that you're trying to investigate, like, it just doesn't seem like it's reasonable to make a requirement like this at this point for a recertification process.
Can I ask, this is Laurel, can I ask exactly how much development time that this is costing you? Because up until I heard this from you guys recently, I had not yet heard a complaint like this about testing. And to address your comment about whether we're addressing a problem in this testing, we are. We have received complaints about vendors not acting compliant, which is why recertifications have been happening and testing has been more stringent than in the past.
Okay, and that makes
the requirements, we've just altered how stringently we've been applying them.
That makes sense, but it doesn't account for it accounts for only a cookie cutter type of implementation. And it doesn't account for the different way that software vendors develop software. And so I would just say that there's probably a creative and reasonable solution here where you can get the confirmation that you need that a vendor is compliant without making them throw away code. When it comes to, you asked about the effort, I personally haven't looked at what all the test cases are. I don't know if Keenan, if you've done that, but so I can't answer that. So I don't know how much work it is at this point.
I haven't personally looked. Peter has looked because he's handling that. It's still more than none.
And the reason we haven't looked yet is because it just feels unreasonable. Like, we've never had to do something like this before to add throwaway code.
Yeah, this is quite. I think we understand the position here, and we're clearly not trying to make this process be unwieldy. We certainly want to make sure that it's ensures that we have good quality products going out that meet the requirements that are necessary. But we're not in the business of asking vendors to develop stuff in throwaway code. So let us. We haven't had a chance to discuss this question that Keenan brought up just in the last couple of days because we've been busy with other things. Let us have a chance to put our heads together here, as Renee mentioned, and see if there's something creatively we can do here for 3.4, and then we'll just get back we can get back to folks either through the Google group or on the next call.
That's appreciated, Clay. I was just going to say that if you need any further input from us, or if there's any other vendors or in the same boat, we would be happy to participate in helping come up with some creative solutions. We are totally open kimono. We will show you anything in our system. We will show you all of our capabilities. So there's nothing for us to hide here. We're doing the right thing. We'll prove it to you, but we just don't want to throw away work. So we appreciate any creativity here. Thanks.
Yeah, I'd just like to add, if you do have a proposed solution, please email me and let me know. That goes for anyone on the call, and we'll discuss it here. One thing I want to make sure we do with any proposed solution for this problem is that it is equitable to all vendors, and I can apply it to everyone, including those who have already implemented the test cases as written in compliance testing. I have a really hard time saying that we would change the process for a single company or a subset of companies while already having made other companies fulfill a more rigorous requirement. So if you have any suggestions that would address that aspect, I would appreciate that as well. But email us your ideas and we'll discuss internally.
Are there any other issues for open forum?
Yeah, this is Clay. I'd like to ask one more question, if I may. David, I think your phone's unmuted. Your computer's unmuted, by the way, David. A quick comment. I'm sorry. I'm just realized that based on our conversation about the development of some type of an implementation guide for the movement of a patient care report from an ambulance to the hospital, maybe I didn't ask a basic question just to help us determine a direction. Among the vendors that are on the phone, how many folks actually utilize that ANSI approved HL7 CDA implementation guide for moving a patient care report to an ambulance? How many companies use that?
We don't. We usually use CCD.
Okay, thanks, David. Zol, did you guys use it?
I think we only believe it, or we only use it in a couple instances. Our custom solution groups typically build them, and I think most of them are CCD.
John, how about R1? What are you guys moving data into emergency departments?
No, we're not using it.
Okay, you're not using it. Okay. Anybody else? Elizabeth with Golden Hour, did you guys use that? Maybe Elizabeth's away from the phone. How about AMR? Jennifer, did you guys share data electronically with emergency departments? Okay. Keenan, I want to feed back to just a statement that you made when we were talking about this exchange guide. I think you said something about HL7 just not being the player to utilize. Was I interpreting that correctly? Are folks relying on you to still build things that comply with CMS approved HL7 products?
Yeah, we're doing sort of the gambit across the board, right? We haven't really leaned anywhere until recently when we've sort of starting to lean deeper into our HIE products. But we're basically developing all of them in all standards.
Okay. Any other comments? All right, thank you.
Are there any other questions, comments, concerns? Our next meeting is December 4th, same time, same place. We've adjusted dates for the holiday season, so December will be 1st and 3rd Wednesdays, and then we go back to a normal schedule starting back in January. Please let us know if there are any items that you want addressed on these V3 implementation calls. We're happy to add those to the agenda or to the open forum and go through those with you. Any questions or concerns or follow-up with the conversation today, everyone in the TAC is available, and you can find that information on our website. If you don't have it, you can go to support, and all of us are here in different options here for you to find our contact information. So if that is all for today, we'll say thank you for joining us this morning and taking time out of your busy schedules. We appreciate you being here, and we appreciate your comments and interaction. Thanks, everyone. Have a great day.